ये जो इंडिया है ना, day after day, thousands are dying of COVID-19, yet oxygen shortages, ICU bed shortages, bureaucratic chaos is all we have. Look at this visual of mass cremations. Do we really need to see this to understand the scale of the tragedy? Look at this video. The agony of one man gasping for breath on the floor of a Karnataka hospital. It sums up the state of the nation. But is anyone listening? 8 out of 20 pages in Rajkot's Sandesh newspaper on 23rd April were just obituaries. But is the Sandesh reaching the Sarkar? My colleague Arup Mishra too has been putting out a series of cartoons to capture the tragic irony between the government's slogans and reality. But the most scathing criticism of our government's mishandling of the second COVID surge has come from India's law courts. And who could be more objective than that? Here, with the support of my colleague Karan Tripathi, let me sum up what a series of high courts from across India have said. On 19th April, the Allahabad High Court called out the UP government for being unprepared, saying it is a shame the government knew of the magnitude of the second wave but never planned in advance. In a direct reference to Chief Minister Adityanath, Justices Ajit Kumar and Siddharth Verma said, those at the helm of affairs of governance are to be blamed for the present chaotic health problems. They even asked why the government failed to counter the pandemic even after one long year of experience. The court also commented on the money spent by the Yogi government on panchayat elections. We would be laughed at that we have enough to spend on elections and very little to spend on public health. Then on 22nd April, a bench of the Karnataka High Court led by its Chief Justice A.S. Oka questioned the state government on the availability of oxygen, remdesivir and hospital beds. Describing the situation in Karnataka as very, very bad, the court said, if patients are unable to get remdesivir in adequate quantities, it is a violation of Article 21 of the Constitution, which guarantees every citizen the right to life. Does it really need a law court to say provide remdesivir or share COVID test results within 24 hours? Offer a government such basic advice? No, but unfortunately, that's what we have come to. Let's move on to Maharashtra, where on 21st April, the Nagpur bench of the Bombay High Court pulled up the state and centre for failing to comply with its order to supply 10,000 units of remdesivir in the Vidarbha region, saying, if you don't feel ashamed of yourself, we are feeling ashamed of being part of such a nasty society. You are neglecting and ignoring patients. We give you a solution, you do not follow it. You do not give us a solution. What absolute nonsense is going on here? Absolute nonsense. The exact words of Justices S.B. Shukre and S.M. Modak. On 16th April in Gujarat, a High Court bench headed by its Chief Justice Vikram Nath took the Gujarat government to task for hiding COVID data on cases and deaths. Hiding the real picture, suppressing accurate data would generate far more serious problems, including fear, loss of trust and panic among the public. Does it really need a court to point this out? No. And why would a government hide data? Well, to hide its own failures. And would you trust such a government? No. And if trust breaks down at a time like this, what's left? Then on to Delhi. On 21st April, Delhi's Max Hospital moved the Delhi High Court asking for help. They had just 4 hours of oxygen left for 262 COVID patients. The High Court directed the government to ensure oxygen supply by all means necessary. It also had very strong words for the central government's lack of preparedness. Why is the government not waking up to the reality? How is the government so oblivious of the ground reality? We can't let people die. Justice Vipin Sanghi also commented on the shortage of hospital beds, saying, forget the common man on the street. Even if I were to ask for a bed, it would not be available right now. And then in Bengal, on 22nd April, the Calcutta High Court Chief Justice T.B.N. Radhakrishnan pulled up the Election Commission or EC on its handling of the Bengal elections in the middle of the COVID second wave. He said, "The EC is empowered to act, but what is going on? Just passing circulars and leaving it to the people?" Referring to the legendary tough election commissioner, the late T.N. Seshan, the court said the EC is not doing 1/10 of what T.N. Seshan had done or what he would do. Meanwhile, the EC has capped the numbers at an election rally at 500 people. What sense does that make? Is 500 a safe number? No. If more than 500 turn up, can the EC stop them? No. So what is the Election Commission of India thinking? We don't know. And that should worry us all. Meanwhile, on 22nd April, on his last day at work, former Chief Justice of India S.A. Bobde said, multiple COVID cases on key issues like oxygen and drug supply, vaccination and lockdown being heard by the various high courts may lead to confusion, and so these cases may be transferred to the Supreme Court. But several senior lawyers have criticized this view for two reasons. One, state high courts may be best placed to evaluate the local situation and rule more appropriately. And two, the apex court's own sluggish track record in intervening on critical COVID cases both now and in 2020 does not inspire confidence. Quite frankly, it's a view we agree with. Ye jo India hai na, if our high courts are being effective watchdogs in these times of never before tragedy, compounded by administrative chaos, if our high courts are stepping up to fight for our right to life, then more power to them.